9,966 tests have been run in the state of Illinois, with 25,993 being reported in the last 24 hours. As of midnight, 3,649 individuals were hospitalized with COVID-19, and of those, 1,009 patients were in the ICU and 576 patients were on ventilators. Since yesterday, 1,527 new confirmed cases of COVID-19 were added to our Illinois total, which brings our total confirmed cases to 115,833. Yesterday, many of you may have noticed that we passed a grim milestone, if you will, of over 5,000 lives lost. We are at a total of 5,186. I would be remiss if I didn't offer my condolences and my sympathies to the families of all those who have lost loved ones associated with this virus. We are all truly sorry for your loss. Fortunately, an additional 104 individuals were reported to have lost their lives in the last 24 hours. So among those that have passed associated with COVID, almost 44% were those in long-term care facilities. And as we've known from the beginning, nursing homes and other congregate settings have always been at increased risk for outbreaks. On March 14th, we reported the first COVID-19 case in a long-term care facility in Illinois. IDPH was on site immediately to provide guidance on infection control practices, to ensure proper donning and doffing of PPE, and to assist with mass testing. This plan was put into action with the full support of Governor Pritzker, and we can't thank him enough for his encouragement and always wanting us to be proactive in all of our responses. I remember going to that first facility in DuPage County to support the team that consisted of the nursing home staff, as well as local health department staff, IDPH staff, and our infectious disease consultants. Of course, it's helpful to be there to see firsthand what's happening, and it was a great example of collaboration. We do understand that the burden of disease in facilities is high in these high-risk congregate care settings, but we're ensuring that swift action is being taken, and we know that facilities must immediately notify public health officials of any confirmed COVID-19 case, whether it's a staff or a resident. And this notification should also confirm that that specific facility is notifying all staff members, all residents, families, and their representatives by the end of that day. Our dedication to this population has never wavered. We continue to support long-term care facilities. We continue to promote the health and safety of everyone therein, the residents and the staff alike. As a state, we are definitely headed in the right direction. We have successfully met the metrics to advance into phase 3, but we must still proceed with caution. The risk of contracting the virus remains. So I implore that we continue to practice the use of face coverings, washing our hands, and be physically distant as much as possible with a minimum of 6 feet. Let's continue to do the hard work that is necessary to get us to the other side of this pandemic. And with that, I will summarize comments in Spanish. Buenas tardes y gracias por acompañarnos. Empiezo con el reporte médico para hoy. Reportó 25,993 pruebas hechas fueron reportadas en las últimas 24 horas. Hasta anoche se informó que 3,649 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 1,009 pacientes estaban en la unidad de cuidados intensivos y 576 pacientes estaban en ventiladores. Desde ayer, 1,527 personas han sido diagnosticadas con COVID-19 y ahora tenemos 115,833 casos totales confirmados aquí en Illinois. Ayer pasamos el número de 5,000 vidas perdidas por COVID-19. Seré negligente si no ofreciera mis condolencias y sinceras oraciones con las familias que han perdido a sus queridos a este virus. Realmente lamento tu pérdida. Desafortunadamente, se reporta 104 personas adicionales con COVID-19 que han perdido la vida, para un total de 5,186 muertes. Casi 45% de las personas con COVID-19 que murieron eran residentes en centros de atención a largo plazo. Hemos sabido desde el principio que los asilos de ancianos y las casas de congregación tenían un mayor riesgo de brotes. El 14 de marzo reportamos el primer caso de COVID-19 en un asilo de ancianos aquí en Illinois. IDPH estuvo en el sitio inmediatamente para enseñar las prácticas de control de infecciones, garantizar la colocación y puesto del equipo de protección personal y ayudar con las pruebas. Este plan se puso en acción con el apoyo del gobernador Pritzker. No puede agradecer lo suficiente para su ánimo a ser proactivo desde el principio. Yo recuerdo visitando este asilo de ancianos en el condado de DuPage para ver de primera mano lo que estaba sucediendo y lo que se necesitaba. Nuestra dedicación a esta población no ha cambiado y seguimos apoyando los asilos de ancianos por la salud y la seguridad de los residentes y trabajadores. Todavía no se acaba esta lucha. Tenemos que seguir adelante. Por favor, sigan cubriendo sus caras, avancen sus manos y estén físicamente distanciados. Ahora nos podemos. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. And I want to begin today by bringing your attention to the charts that are here to my left, reflecting how each of Illinois' 4 regions has fared in meeting our Restore Illinois metrics. All of this data is updated every day for you to track for yourself on our IDPH website, dph.illinois.gov/restore. But I wanted to bring the May trends to your attention in recognition of the end of Phase 2 for all 4 regions of Restore Illinois. As you can see, each of the 4 regions has hit the 3 requirements for moving into the next phase: at or under a 20% positivity rate and increasing no more than 10 percentage points over a 14-day period, and no overall increase, so stability or a decrease, in hospital admissions for COVID-19-like illness for 28 days, and available surge capacity of at least 14% of ICU beds, medical and surgical beds, and ventilators. Starting tomorrow, all areas of the state are eligible to reopen in accordance with Restore Illinois Phase 3, which offers specific guidance on how things like outdoor dining, outdoor recreation, manufacturing, retail, personal care services, and offices can move forward with safety measures in place. All of that is available on the Department of Commerce and Economic Opportunity website, where you can find it at illinois.gov/business guidelines, illinois.gov/business guidelines. I want to let parents and kids know that we have provided guidance to day camps and youth sports to allow the return of those activities for children across the state. Summer activity is so important for overall health, and the doctors have given instructions for counselors and coaches so that summer programs can be restored with safety measures. Later today, we will also be posting recommendations for houses of worship, providing more guidance for houses of worship in Phase 3. Having received many plans and ideas from responsible faith leaders, IDPH has reviewed many detailed proposals and has provided guidance, not mandatory restrictions, for all faith leaders to use in their efforts to ensure the health and safety of their congregants. This includes suggestions on capacity limits, new cleaning protocols, indoor gatherings of 10 persons or less, a reduction of activities like sharing food, and the safe conduct of outdoor congregating. The safest options remain remote and drive-in services, but for those that want to conduct in-person activities, IDPH is offering best practices. Additionally, with Phase 3, horse racing will be returning to Illinois tracks, boosting the industry in a key season, especially for thoroughbred and harness racing. The Department of Agriculture has worked with the IDPH, with the Illinois Racing Board, and industry leaders to develop guidelines for racing, allowing those whose livelihoods depend on these races to get back to work, and allowing spectators to watch from home and place wagers online and over the phone. And while it's still at least a few weeks off, I want to affirm that the three metrics that have brought us from Phase 2 to Phase 3 will be the same as those that will move us into Phase 4. Just as this 28-day period of tracking started when we moved from Phase 1 to Phase 2 on May 1st, our next health metrics calendar will restart tomorrow and run for the same period, meaning that regions that meet the metrics could move into Phase 4 possibly as early as Friday, June 26th. That's the earliest possible date, and we will be watching the metrics closely in hopes that we will move forward expeditiously. But our goal is, and always has been, to keep people safe from this coronavirus while we restore more of our normal activities. So it's important that we remain careful about continuing to wear face coverings, washing hands, maintain 6 feet of distance, wiping down surfaces, using hand sanitizer, and other mitigations. Let's not move backward, but instead, let's move forward together. Because Restore Illinois is a plan that has 4 regions, Northeast, North Central, Central, and Southern, we will restart our tracking of the data for each region beginning Friday. As always, individual townships, counties, municipalities can choose to operate on a stricter schedule and with stricter metrics. With that, I'd like to talk today about long-term care facilities, which have been at the center of our COVID-19 response since day one, and which will continue to be a central focus of our work especially as we safely reopen sectors of our economy. The overwhelming majority of long-term care facilities in Illinois are privately run. In response to the COVID-19 crisis, some of those facilities have acted proactively, some only reactively. CDC guidelines have provided those facilities with the roadmap for managing infection control through this crisis. But at the state level, we've gone beyond CDC guidelines to provide free testing of residents and staff by our IDPH nurses, consistent communication of best practices, and individual facility consultations with infection control experts. And we have delivered PPE to every nursing home in the state and to all counties with long-term care facilities. Of our roughly 1,100 long-term care facilities that care for elderly Illinoisans, over 900 have been connected with directly and in person by the IDPH Office of Healthcare Regulation, IDPH consultants and coordinators, IDPH's teams of nurses, or members of the Illinois National Guard. That includes visits to provide help with testing or staff PPE training or support for existing staff to administer tests or a whole host of other supports. Our IDPH consultants and coordinators interact regularly with the statewide network of 97 local health departments, which remain the front line of communication and support for private long-term care facilities in all elements of our COVID-19 response. Our state's response teams going into nursing homes have evolved over the course of this pandemic, so I want to bring you all up to date. We now have two groups of nurses fanning out to long-term care facilities around the state. One group of 200 IDPH nurses who are doing focused COVID-19 infectious disease control surveys to monitor compliance, and who can also conduct swab testing, train existing staff to take specimens themselves, and review and improve each facility's PPE use and hygiene practices. And a second group of 100 contract nurses, which we doubled at the end of April, who are also monitoring for infection prevention and control, but also providing additional testing assistance. We now have 10 teams averaging visits to 2 homes a day each, potentially as many as 140 a week across the board. Those teams are ensuring best practices to keep residents safe and helping test residents and staff for facilities that have requested assistance when they cannot manage it themselves. Some long-term care facilities opt out of the free assistance of IDPH's response teams, sometimes because they choose to take their own specimens using IDPH swabs, or because they choose to work with their county or city health department instead. Others work with their local hospitals and health centers to source and conduct tests. To date, we've sent about 45,000 testing kits out in 200 shipments, up from 18,000 swabs to 68 facilities back in late April. Still others have declined the free visits and even the free testing supplies from IDPH entirely. As I've explained, these are largely private entities, and even as we work to ramp up regular testing of all our long-term care residents and staff, my administration has received some pushback from owners and industry representatives, making it difficult to secure compliance across the board. As a reminder, from the beginning of this crisis, we've put our long-term care facilities, and especially our nursing homes, among the highest priorities of our COVID-19 response. In the earliest days of March, we implemented strict protocols at our state-run veterans homes and congregate care facilities and provided similar guidance to the hundreds of privately owned facilities statewide. And at our March 5th briefing of the General Assembly, we offered copies of those recommendations to all state legislators to get their help in instilling a sense of urgency in long-term care facilities in every corner of the state. Many facilities have been great partners, and they should be applauded. But long-term care residents are some of our most vulnerable Illinoisans. That's why strong compliance from many isn't good enough. To counteract any heel-dragging at any privately held nursing homes, the Illinois Department of Public Health is today filing a rulemaking requiring each facility to develop its own individualized testing plan and document an established relationship with a testing lab, whether it's a commercial lab, a local hospital lab, or our state labs. This new rule will require nursing homes to conduct testing when experiencing an outbreak, when an outbreak is suspected, periodic testing even when there is no sign of an outbreak, in line with new federal guidance issued this week, or when directed by IDPH or their local health department to do testing. The rule also mandates compliance with infection control recommendations at large. Test results should be used to identify asymptomatic cases, to confirm infection in symptomatic cases, to evaluate quality indicators, to follow up on infection control programs, and to support decision-making. To be clear, this rule doesn't deviate from our existing priorities, but it gives IDPH, a regulatory agency, additional teeth in securing buy-in from these private entities. Administrators who decline to provide a testing plan will be found in violation of the rule. The challenge of protecting elderly Illinoisans who live in congregate settings, many of whom have underlying conditions, is evident in the heartbreaking percentage of illness and death that have been seen nationally in LTC facilities. COVID-19 is unrelenting, and it has visited its worst effects on older Americans. But our state will continue to use every resource at our disposal and the collective medical experience from across the nation to protect our seniors throughout this crisis. And with that, I'm happy to take questions from members of the media. Tina?
Governor, what is the punishment there if these nursing homes do not abide by this rule?
A typical IDPH regulates nursing homes, so they have the ability to issue violations as they do with other regulatory matters.
And that would be like a licensing thing, or could it include a fine? Or?
It's typically a fine, yeah, but it can involve their licensing too.
Okay. Governor, you said, I think on Sunday, the legislature did not pass that measure that you wanted to punish businesses if they didn't follow the executive stay-at-home order. Mm-hmm. And I'm wondering, are you planning to file any other sort of rule? I know we're going into the reopening phase, but what will happen? Do you want any sort of other emergency rule in place should these businesses not abide by your plan?
Well, we're continuing to look at that, but I will say that, what we've been left with because of the inaction by the legislature is the removal of licenses, which is something we didn't want to have to pursue.
So as of right now, if they don't follow, they can have their licenses removed?
They could.
Okay. Regarding some other legislation that failed over the weekend, there was a FOIA bill along with a bunch of other things in this one bill. Your administration said you did not support that. So can you tell reporters in the state what it will look like for the FOIA process right now? Will we have delays for X amount of weeks, and what is the reason for that?
Well, I can't speak to all the other levels of government and how they will respond. I mean, we know what the FOIA laws say today. As I've said from the beginning, in the midst of the pandemic and in this emergency, it's taken us a little longer to be responsive, but we are responding to FOIAs as fast as we can. But again, given that some of the staff are at home, some have been ill or otherwise unable to respond, we're just asking a little bit of forbearance for small periods of time, but we are responding to FOIAs as requested.
And that's notifying people that there are delays at every instance?
That there will, I'm sorry?
There will be delays, your department or your administration?
I think I've made that, I've made that clear, and I think we've notified people as much as we can and are required to, but it's our intention to fulfill the FOIA requests.
Okay. A question for Dr. Ezike. I know we've talked about nursing homes a lot over the past 2 months. Is there any sort of metric of nursing home residents that have died of unrelated to COVID, maybe from other illnesses that kind of were exacerbated by maybe lack of visitors or something like that?
Yeah. So again, when you're dealing with this population that obviously has the major risk factor of being elderly and has the additional risk factors of having multiple comorbidities, it's really hard. I don't think there are any individuals in that group that don't have 1, 2, 3, multiple of those high-risk factors. So I think all of those fatalities, as unfortunate as they are, would absolutely be COVID deaths. In terms of, did someone die of a broken heart? I don't know how to assess that, so I don't really think there's a metric that I could give that could really get to that.
Yeah, I just mean, is that being counted as it's a separate subset of people who have died in nursing homes during this time of unrelated illnesses?
I don't think there are any that would satisfy that criteria where they had no other medical problem, that they were completely healthy, and that this infection was just a coincidence, and that there was not something related to the COVID. I think all every one of these deaths had a direct tie to the COVID infection, and that spurred on. Again, they had other conditions, definitely, but this COVID absolutely had some kind of contributory role.
I have a question for the governor from Kelly Bauer from Block Club Chicago. A Chicago church has asked the Supreme Court to overrule your stay-at-home order. Do you have any concerns about this action or the fact that churches continue to hold services with millionaires like Willie Wilson paying their fines?
Well, multiple federal judges have reviewed and upheld the approach that we've taken with our executive orders with regard to houses of worship. So, these courts have recognized that there's a public health crisis that's ongoing and the need to take steps to protect public health, as we have, including as related to religious services. I think we all are aware of circumstances in which there have been infections that have been spread during religious services that were held with many people packed together. The Attorney General's office will be filing a response as is required in the case that you're referencing.
Okay. How will you protect and provide relief to workers who don't feel safe returning to work next week in phase 3?
Well, the first thing we're doing is imploring and providing guidance to employers that the employees should look at too. All of that is available again on our DCEO website. And employees that find that employers are not following that guidance should report that their employers are not following it. And of course, that should be reported either to the Attorney General's Workplace Enforcement Office or the Department of Labor, both of which have the ability to enforce it.
But for employees who just might not feel safe going to an office yet next week, what do you advise those? I know you've said private businesses should use their discretion.
Private businesses need to use their discretion. In fact, especially when it comes to the most vulnerable, people who have pre-existing conditions, employees should make those, to the extent they are able to, make those known to their employers so that their forbearance can be given to them for that. But, obviously what we're looking for here is a common decency that should come from employers. And then, of course, we'll rely on enforcement wherever we need to.
This is from Greg Hines from Cranes. Some other states, including some with Democratic governors, are making deep budget cuts rather than counting on federal help. Why are you plotting a different course? Are you prepared to make more cuts in this budget if the only help you get is Federal Reserve loans that have to be repaid?
Yeah. So, as I've said all along, this is not a time for governments, state governments particularly, to be cutting services, especially a government like ours where agencies have been hollowed out over a number of years. As you saw, I've attempted heartily to try to build back up some of those agencies, but I've known, and I think everybody else has known, it would be a multi-year process to do that because it took many years to slash and burn those agencies. Look, I also recognize that if the federal government does not step up to the plate, that we're going to have massive cuts. Everybody understands that, and we will have to revisit this, right? But the legislature will meet for sure in November for a veto session, and perhaps sometime in between, and we'll be evaluating whether or not the federal government did do what I think everybody hopes and expects that they will do. Again, we're not in a unique position. What other states have done certainly is some states have put forward cuts that they might put into place if they're unable to get support from the federal government. What we've said is, look, we'll be working very hard to do that, but our sincere hope is that making cuts now would be so bad for working families and for people who've been out of work now as a result of COVID-19, that what we'd like to do is maintain state government as it is, again, still hollowed out to some degree, as it has been over the years, and then we'll manage through as the next month or so reveals whether the federal government will step up.
This question's from Jim Leach from WMAY Radio. The Restore Illinois website today says the central region is not meeting one specific metric for phase 3 reopening, which is the hospital admission change. Is that one metric alone enough to delay moving to a new phase? Does the state have flexibility in determining how to use those metrics?
Actually, I saw the updated numbers from today's numbers. When those got added in, I think in the last hour, you'll find that as it happens, the central region is now meeting all those requirements. But even if it had been the number from yesterday, it's very, again, the idea here is stable. And, when you talk about 2%, that's stable.
This is from Dan Petrella from the Tribune. With the start of phase 3 coming tomorrow, how long will it take to gauge whether loosened restrictions lead to any increase in infections, hospitalizations, or deaths? How is IDPH prepared to respond if that occurs?
Once again, the whole purpose of each phase and the reason there's a 28-day period involved in each phase is to monitor when you make the changes. Yes, we all have to watch, and 1 day, 2 days, 7 days, even 14 days isn't enough. We see that in other states, it sometimes takes 3 weeks, even more, before you really start to see the effects of an opening up. So that's why we have a 28-day period for each phase and a monitoring period of 14 days or 7 days, depending on which metric you're looking at.
This is from Leisha.
Oh, I'm sorry.
Leisha,
You asked,
sorry.
what would we do if, yeah. And again, that's spelled out in the plan that it's possible that if we have a surge, a spike, and we need to quell that spike, we might potentially have to move backward in the phases. That's not something any of us wants to do, but certainly it wouldn't allow a region of the state to move forward if it wasn't meeting the metrics that we've set.
Could there be restrictions loosened in between that next phase, just as the restaurants and bars you offered up last week?
Look, that's not our intention, but it always is true that more information becomes known, and it allows us perhaps to make adjustments. And as we learned, for example, about outdoor dining, that if you maintained the social distance, and again, this is from experience, also the advice of epidemiologists, that, as we've learned more, I've always said that we can change the playbook as we go, but it's not our intention. I mean, we think that the science is pretty good that's dictated where we have gotten to and where we're going. And I would remind everybody that Illinois was just named as the only state in the United States that was meeting the guidelines that were set by the federal plan for reopening that was put together by Dr. Fauci and presented as the federal government's plan.
This is from Leisha Bushek from WILL in Champaign-Urbana. Will maximum SNAP benefits be provided to all recipients in June as they were in April and May?
I do not believe that there is a change in SNAP benefits going into June, but I will double check that. I believe that we're continuing on as we have.
Okay. This
Tina,
question.
I'll give you one more and then we'll go to
Sure. It's a little twofer, but it's a casual question from Rich Miller from Capital Facts.
It's a casual question.
It's
Okay.
a little bit.
Okay.
Governor, do you plan on eating outside at a restaurant this weekend? Why not? And once again, are you going to be cutting your hair and going to a barber shop anytime soon?
Well, you can tell I need to have my hair cut, that's for sure. I don't have any plans to dine outside over the weekend, although I did, my wife's birthday was this last week, and we have a little patio at our house, so we did dine outside, just our family together. Oh, I'm going to get my hair cut at some point. I don't have an appointment yet, and I understand that appointments are hard to come by at this point, so I'll get to it as fast as I can.
Governor, good to see you again, twice in 1 week.
Craig, you look
on
like
our
you might
last-
need a trim also.
I have a haircut appointment Saturday morning.
There you go. You got right on it.
So I guess first of all, just another quick aside question. Is Friday going to be the last of the daily press conferences, and are we moving to weekly next week?
I don't think we've made any decisions about that. I mean, our intention is to make sure that you are regularly updated. And as you've seen, I've been here every day. I think we made one adjustment, and that was to allow all of you and all of my staff to have weekend days off. But we're still providing the information that you're seeking over the weekend. And again, we'll always have press conferences when there's a need to make sure that we get information out. But right now, the plan is to continue as we are.
All right. You were asked a little bit about churches, but today 5 churches in Lake County filed a lawsuit against your administration. Stacy Baca, my colleague at ABC7, says the pastor at Zion Christian Assembly of God says that they run a food pantry up there,
Yeah.
which gets state funding. 30 volunteers feeding 1,200 people a week, but they can't have more than 10 people on Sunday for phase 3. How do you respond to that discrepancy, which they says just frankly is not fair to them?
Well, as regards a food pantry, I was in East St. Louis yesterday at a food pantry, and like many nonprofit organizations, they've had to make adjustments in order to keep their patrons safe, to keep the people who use the food pantry safe. I know that lots of organizations have made those adjustments. Nothing is directed here at a religious organization that happens to have a food pantry. It's really the idea here for everybody, for everything, and food pantries specifically, is just to make sure that those who get served are served in a safe environment. So, we provide guidelines for different kinds of food service and organizations, and grocery stores and so on. So I think those would apply here too.
Sorry, I didn't ask the question well, I guess.
Oh, I'm
because
sorry, maybe
The pastor's saying they have 30 people in working the food pantry.
Mm-hmm.
If they can have 30 people to work a food pantry, your guidelines say they can only have 10 people in a service.
Yeah.
And the discrepancy there has frustrated the pastor and resulted in this.
Well, again, we have guidelines that are now available this afternoon will be this afternoon on the DCEO website, and those are our best recommendations. We're not providing restrictions. We're simply providing the best recommendations that we can for keeping people safe. So we hope that the pastor will follow that guidance and those recommendations for his or her services.
But if there's not restrictions, then you're not going to be asking for any enforcement on churches who would violate the 10-person guideline?
As you know, I have never encouraged any police enforcement or any other kind of breaking up of gatherings. What I have said is that pastors should use their judgment and the science and data and should follow the recommendations that have been made. But I realize that some have ignored that.
A couple of questions on IDES. Republicans held a news conference today calling for an audit, the Auditor General to audit what went wrong. Your response to that?
Well, I think I've been very transparent about what the challenges have been. And indeed, if you look at virtually every state in the United States, you can look in the Midwest at Michigan and Missouri and Indiana and Wisconsin. All have had the same challenges. They're challenges of staffing, they're challenges of the systems that were put in place. Nobody expected to have 10 or 20 times the number of filings that have been made over the last 2 months. And again, we've been trying to build that ship and float that boat at the same time. And we're doing the best we can. And 1.2 million applications have been filed, and those filings have gone through. So there are people who remain. There are some people that need arbitrations. There's some people who have challenges because they put something wrong into the system they need to take out of the system, and you can't make easy alterations once you've applied. You may have changed your name for some reason from the last time that you were receiving unemployment to this time. And so those are some specific circumstances that people have to talk to somebody about or use the chat bot that exists online.
Do you support an audit, though? Is that a political move by the Republicans?
I think, of course, that's the right of anybody, but I will just say that we've been very transparent about what the challenges are. If their goal is to figure out what didn't work right, I have stood here I don't know how many times over the last 2+ months and told people what hasn't worked right and how we've been trying to address it. And again, we've brought in some of the biggest, most robust companies in America to help us rebuild those systems so that we could, on the fly, make sure that we're meeting the needs of people across Illinois. But there's no doubt about it, like many other states, some people have, it has taken longer to file and get claims delivered upon than any of us would like.
Moving on, Tara Molina with CBS asks, how do you respond to the claims IDS workers made in their report last night, despite what IDS spokespeople say that they maintain they're just pushing applications through with obvious errors to make up for understaffing?
They can't push through applications with obvious errors. There literally are federal regulations that would prohibit that from happening.
John O'Connor with AP says, Governor, I know the budget relies on CARES funding to balance, but has the state received any CARES funding to date, and if so, how much, and has any of it been spent, and if so, for what purposes?
Yeah, I would disagree with the sense of precarious funding. The MLF is not a precarious mode of funding. It's something that was provided by the Fed because states are having these significant challenges. We're just one of them. I'm sorry, the other part of the question that had two clauses to it, yeah.
Has there been any CARES money received?
Yeah, so yes, as you know, in the prior CARES Act, there was COVID relief dollars. There were COVID relief dollars that can only be used for expenditures related to COVID-19. So it doesn't cover lost revenues related to COVID-19, only to expenditures. So for example, PPE, contact tracing, testing, those are the areas that you can use the funding for, but you can't use it for, to replace the lost sales taxes as a result of the economic impact of this crisis.
A couple of questions about schools reopening in the fall. Elizabeth Matthews and Greg Bishop both asking. Matthews saying, Dr. Fauci said he's unsure if schools will be in session this fall. You've said you hope that they will reopen. What might that look like? What do you tell juniors who are going to enter the senior year? And Greg Bishop wanted to know, how do you ensure parents that their kids are going to get a quality education?
Yeah. Well, I have a junior in my own home, and so this is a relevant question to those of us who have a junior. Look, it's unfortunate that we can't see that far into the future with this virus. What we are trying to do is to set the foundation for any outcome. But again, my hope and desire is for us to have all of our kids back in school in the fall, and I know some schools have already chosen across the nation. Some states have chosen to do that. Some are in the position that we are still considering, whether it is safe for our kids. But the most important thing is the kids and the people who work there, the teachers and the administrators and the paraprofessionals, we have to keep all of them safe. And so to make sure that we have the right conditions for that is what we're looking to do.
Benjamin Zamora with Telemundo said a new study by the University of Chicago Poverty Lab found that uninsured and undocumented residents are most likely to be in need of COVID-19 testing, and that there's still a lag in testing in areas where they live. What is the state doing to improve testing ability for them, and your message to the undocumented people still fearful to be tested?
Well, I can't speak to all undocumented communities. I mean, I absolutely agree that we need to make sure that testing is available to everybody. First, I would say all testing that we are involved with, and I think we have over 260 sites across the state, all that testing is free. So anybody who needs a test that meets the criteria can go get a test, and those criteria have expanded vastly. To be clear, an undocumented resident of our state has the ability to get a test. There's no citizenship requirement, and you're not required to fill out a form that reveals your citizenship. There may be some federally qualified health centers that have a form with that question on it. You are not required to fill that out in order to get a test. So that's one thing. And then providing the health care that's needed by undocumented residents is also something that we are doing in the state, making sure that people have the ability to get cared for if they get COVID-19.
Believe it or not, I just have two more. David Kenzie with WBZ says there's a huge gap in information about the types of workers getting sick with COVID-19 throughout Illinois as public affairs try to contain the spread of the virus. How is this impacting the state's ability to track and prevent more of the outbreaks? And does the state plan to do anything about this? Also, why is more information not made public? I don't know if that's for you or Dr. Z.
Is this a question about the careers of the people who are?
That's what it sounds like, the types of workers getting sick.
Types of workers.
Yeah.
I mean, we have a very good idea because we know that some outbreaks are taking place in certain work settings, for example, and you all have heard about, for example, pork processing or other meat processing plants as one example. But I'd like to ask Dr. Ezike to come and answer the question about the record keeping around it.
Sure. So IDPH is a master collector of information. We have millions of pieces of data that come into us every day from all different sources. in terms of the actual data regarding people who are being tested and people, obviously some of those tested will then be positive. Again, whatever is put into our databases is what we have. And so I think it is imperative that everyone hears that those forms, whether there's a form that an individual has to fill out, whether it's a healthcare professional that's assisting with papers being filled out, whether it's in a doctor's office, where it's in the drive-through sites, like everything that's put in there, like that's what we have. So if people just say, I'm just going to write my name and I'm going to leave off the date of birth or I'm going to leave off the address, then when we're trying to figure out who this positive case belongs to, we put it in this bucket that has no address until we're able to chase down that information. And we don't know if this is belongs to one of the which of the restore regions it belongs to, or which county had this positive. So again, all of that information is essential. The more information we have, the more information that's given to us, the more that we have to be able to put out in terms of identifying types of occupation, location. We do know from some of our outbreak investigations that you have a specific location when you've gone through the contact tracing and the interviewing, where you've tried to go back and think of all the places, work with the person to identify all the places that they've been, and then you would say maybe, oh, I went to the grocery store on this day. I went to a place of worship on this day. I went to this health club, this place to get hair, nails, massage. So when we get all that information, and then if you get a cluster of people that in that same time frame all identified like a specific locale, that's how we then can put things together like an investigator to say, wow, there were around the same time, we have all these people that frequented this one location, and then you try to hone in, then you try to go to that location, find other people who may have been there at the same time. So again, once we get the critical information that allows us to do further investigation, to have more, and then we have more data fields populated in our database, and then we can put out summaries of more intense information. So again, the data that we get is what we can give out, and so we want to implore everybody to be very comprehensive in all the forms they're filling, and that involves individuals, that involves local health departments, that involves hospital personnel, lab personnel, everyone to work together so we can have as much data so we can answer all these questions.
The most important data, though, that we nearly always get is, of course, how to contact the person with their test results. I just wanted to make sure that sometimes there's missing data on a form, but always there's some way to contact the person to make sure that they know, because that's the most important person involved here, is the person who's being tested.
Craig, this is your last one.
Charlie Morrison at Chicago Public Square. I don't know who wants to answer this one. As large office buildings prepare to reopen after weeks standing by mostly idle, researchers are sounding a warning about the potential for bacteria that causes Legionnaire's disease being in the pipeline. So what guidance do you have for building managers and for people returning to work in those buildings?
Well, there are lots of buildings, as you know, that are in areas that have had Legionnaires or Legionella detected in their pipes. There's one obviously terrible circumstance in Illinois of the Quincy Veterans Home where there are staff at that home too, so workplace where there's Legionella. But in terms of dealing with Legionella, I mean, this is a problem that the state has dealt with for many years. It's not like we need new guidance about how to deal with Legionnaires or Legionella. So it's not really a new endeavor.
Okay, we'll go to questions from online. Hannah at the Daily Line, two very important metrics to get the state to phase 4 are even more widespread testing available to everyone, regardless of symptoms, and contact tracing on more than 90% of cases. To that end, she has two questions. What's the next big testing metric? How will the state get there with federal support of the National Guard sites going away? Does the state have a large order of testing supplies or test machines coming in?
There are many testing machines that exist in the state, and of course, as I've talked about before, contracting with the existing owners of those. They may be hospitals, they may be doctors or others, or commercial labs, is part of our effort to scale up. Obtaining swabs. I mean, you've heard me say this over and over. How will we scale up? These are all the same things that we've been doing, but more. In terms of, what our goals are, we need to do many more than we are. I mean, I would point out that we're currently, as I've, said many times, we're among the large states, second highest in terms of per capita testing. We're the third highest in overall testing among the big states. And so we're going to, and again, the goal is to get to a much higher number. And you've seen us do that. I mean, back when at the, near early on when I talked about us needing to get to 10,000, it took us a few weeks before we were able to get from where we were to that 10,000 number, but we moved pretty quickly from 10,000 to 20,000. We're averaging now about 23,000 a day, but you've seen us hit 27 and 29,000. So, we're going to keep ratcheting that up, and the goal here is to make sure that everybody, whether it's at nursing homes, at our priority locations, gets tested on a regular basis, but also as we are reopening many businesses across the state, that the businesses where there are more at-risk individuals, that they also have the testing available to them.
And then for Dr. Ezike, how many people have been hired for contact tracing? How long will it take for them to be trained? Will the state have enough people by the end of June to move into phase 4?
Right. So just a clarification, when we think about the metrics to move into phase 4, they are the same metrics that we needed to graduate, if you will, into phase 3. So the information regarding the metrics around contact tracing, those are, I guess, internal goals that we all know that we need to. The more contact tracing, the more aggressively we can identify cases and identify potential cases and have people stand down before they have the chance to infect others. So that's not what's going to hold other people back. We're working aggressively to get that online and to get people hired and to get the curriculum. We have some pilot local health departments that we're starting with first, and then we're going to expand. So we will not have the contact tracers in every part of the state next week, but we will branch out and keep growing until we get the full capacity that we need. But again, that is not going to hold the state back, but we know that that is an important part of the master plan in order to keep our state safe, to be able to quickly, rapidly identify people who are positive and be able to identify their contacts so that they can stand down before they potentially infect someone else.
Sarah, at the Chicago Daily Law Bulletin, an emergency rule filed May 22nd suspends the 30-day time frame for an IDPH inspection that arises from a nursing home complaint, except for allegations of abuse and neglect. Why was this rule needed? Does it apply to inspections by local health officials?
So at the state level, I think the feds understood that in the midst of this pandemic that we were going to be focusing on COVID response and trying to address the nursing homes as they are clearly the highest risk setting for the entire state, for the whole country, for the whole world. And so they wanted us to focus on the COVID response, but of course made that exception for things that would be considered immediate jeopardy. So for things, essentially IJ means some offense that's so egregious that you could immediately have to suspend a license. But so other things have been put on the back burner as we progress, that might be loosened. But again, we're following the federal guidelines.
Jim Haggerty at Rock River Times. Governor, we've heard from people who say they're not going to return to restaurant or bar jobs but stay on unemployment until something else comes along. Will those who make that decision run the risk of losing their unemployment benefits?
Well, that's a decision the federal government would make. I mean, there are regulations around that. It's able and available, I think, is the standard here. And so that's not really a decision that we'll make at the local level.
Shia, Politico, churches, gyms, theaters, they all seem to think they can operate in a way that's safe. To what extent are you rethinking when to let them open to more people and customers instead of just 10 people in this upcoming phase?
Theaters and gyms, you're throwing those together. Well, those are a bit different. Gyms tend to be smaller, although I know there are some that are quite large. But and we have provided guidance for certain activities at gyms and fitness centers. But theaters, I think there's a common belief that the experts seem to tell us anyway that it would be difficult for us to open theaters in the near future in phase 3.
Cole from WCIA. How are malls meant to move forward during phase 3, and will businesses and malls operate differently than other businesses?
Now, Dr. Zika, do you want to address that? Malls, indoor malls, I assume we're talking about.
So
Outdoor malls would be different.
Yeah, so most of the guidance were thinking of businesses as solitary individual businesses, and so the rules that applied in terms of capacity, how many people could be in the store, how many people per 1,000 square feet, so those I think would continue to apply for individual stores, and then if they happen to be within the context of a mall, I don't think the rules change. So I think it's still the rules that are prescribed, or the guidance, I should say, the guidance that is prescribed for individual businesses, whether it's a personal care facility, the same rules would apply in terms of what services can be done. There are, I think some of the things that might be hard to implement would be some of the recommendations surrounding like extending the hours so that you have lower population density, if you will, in any one establishment at the time. Your ability maybe to flex the hours might be limited by the hours of the mall in general. But otherwise, I think the individual facilities and businesses follow the same rules that are prescribed on DCEO website and our website.
This will be our last question. It's from Brian at the Southern Illinoisan. Governor, there has been a growing COVID-19 outbreak at the Pulaski County Jail, which also serves as an immigration detention center in rural Southern Illinois. Recent reports from ICE state now 29 detainees have tested positive for the virus. This is in a county with multiple challenges in regards to access to health care. In response, there have been calls from advocates and public health professionals for IDPH to inspect detention centers and ensure the health of those who are held by ICE. How do you respond?
I know that we are prohibited, maybe I could turn over to Dr. Zika. I know we're prohibited from inspecting a federal facility, but I'm not sure how it would apply here to a county jail.
Yeah, so we have, again, that is a federally run facility, but in Pulaski County, the local health department has been involved with that. We have